Here it's Wisconsin Today. I'm Rob Farrett.
And I'm Kate Archer-Kent. Last week, U.S. Health and Human Services Secretary Robert F. Kennedy Jr. removed all 17 members of the agency's Advisory Committee on Immunization Practices from their positions.
During his confirmation process earlier this year, Kennedy indicated to a key senator that he wouldn't make changes to that committee, which advises the Centers for Disease Control and Prevention on federal vaccine guidelines and requirements. Here's Republican Senator Bill Cassidy of Louisiana, a doctor, describing the commitment Kennedy made to him to secure his confirmation vote.
It confirmed he will maintain the Centers for Disease Control and Prevention's Advisory Committee on Immunization Practices recommendations without changes.
But in a Wall Street Journal op-ed, Kennedy said the committee was plagued with conflicts of interest. He has since named 8 new appointees, many of whom were critical of federal COVID prevention guidelines and mRNA vaccines during the COVID-19 pandemic.
A Wisconsin physician is a former chair of that committee. He joins us for a look at the possible impact of these changes and whether they could affect access to vaccines here in Wisconsin. Dr. Jonathan Tempe is professor of family medicine and community health and the associate dean for public health and community engagement at the UW School of Medicine and Public Health. He chaired the Federal Advisory Committee on Immunization Practices from 2012 to 2015. Dr. Tempe, welcome back to Wisconsin Today.
Well, thank you so much for having me, Rob. It's a pleasure to join you.
Can you tell us about the importance of this committee, Dr. Tempe, why it's getting attention, why it was a potential stumbling block for the confirmation of the Health and Human Services Secretary?
Yeah, absolutely. And by way of background, I'll just say that I've spent about half my adult life working with the Advisory Committee on Immunization Practices, and it's an organization that I know well and care greatly about. This is the group that makes recommendations for the entire United States in the appropriate use of vaccines. And we consider the safety foremost and the effectiveness of vaccines as we deploy them across our population. So any changes within ACIP really sends shockwaves through the medical and public health community.
Secretary Kennedy said he's replacing the committee in part because it was plagued with, quoting here, plagued with conflicts of interest. What is the process of disclosing and preventing conflicts of interest on this committee?
Well, I always like to tell people that the best way to not get on ACIP is to have conflicts of interest with vaccine manufacturers. I sat for a number of years, I think 5 or 6 years, on the steering committee of ACIP, where we would vet potential nominees and come up with a short list of 2 nominees for every opening. But we very, very rigorously screened for conflict of interest. And when there was a potential conflict of interest in members who actually got on the committee, they were prevented from voting on any matter for which they had either a conflict of interest or a perceived conflict of interest. So the rigor was really, really high. So this claim of high levels of conflict of interest is coming out of left field, and we don't know where this is from.
Process-wise, dropping all 17 members of this committee at once, bringing in a group of 8 new appointees in pretty short order, how does that contrast with how this usually had worked?
Well, by charter, ACIP has members that are required to overlap terms. And typically, a person will have a 4-year term, and approximately 1/4 of the ACIP members would rotate off each year, and we would get 4 new. That provides institutional memory. When I first came aboard, the learning curve was nearly vertical. It was really a lot of information to try and take in. And so it's really important to have that institutional memory. CDC by nature is a very, very cautious and precise organization. And things are done very, very carefully in terms of how information is put together, how it is packaged for the public, and so on. And this is a really radical change. And I worry that it's being done too quickly without appropriate scrutiny of the potential outcomes.
Looking at potential outcomes, we've seen at least 8 appointees here. As you look at the names and backgrounds of people involved, do you have concerns?
Well, some of the members are definitely within the camp of people with expressed viewpoints that we would consider anti-vaccine or very controversial with their viewpoints. I think beyond that, though, one of the concerns I have is when I look at the agenda for the meeting coming up next week, for example, on the COVID vaccine, we see individuals who are presenting for CDC who the names I don't recognize, and they have not been part of the work group that I've been a part of for the last 5 years. And so what we're doing is really stepping away from the tradition of high quality, careful consideration and throwing things together without much planning. And it's going to be very interesting to see what comes out.
One of the arguments, I think, from Secretary Kennedy and others in his camp are they need diversity. They're looking for viewpoint diversity on these committees, that there's been a laser focus on pro-vaccine voices, I guess. Is there a case to be made that having different voices on this will make us look at vaccines in a better, more rigorous way?
Well, I think the proof is in the pudding. We'll see what comes out of this meeting. For example, one of the votes is going to be on thimerosal-containing influenza vaccine recommendations. And I hold this up as a litmus test because thimerosal in vaccines is settled science from 20 years ago. This is a mercury component, which is at very, very low levels. The typical amount in the few vaccines that do contain it is less than you would get from eating a half can of tuna. But if ACIP votes to suspend thimerosal-containing influenza vaccines, it will be absolute proof in my mind that they are no longer using an evidence-based framework to make vaccine recommendations. And so I think this is something we want to watch for over the next week.
We're talking to Dr. Jonathan Temte at UW School of Medicine and Public Health. He was the chair of the Federal Advisory Committee on Immunization Practices from 2012 to 2015. That committee, all members were dismissed, half replaced so far by Health Secretary Kennedy. Dr. Temte, here in Wisconsin, if we're looking at, for example, our fall vaccine lineup, our COVID vaccines, what do decisions made by this committee mean when it comes to access to vaccines and maybe insurance coverage of vaccines?
It's a great question, and the answer is yet to be seen. ACIP recommendations have a statutory component requiring insurers to cover at full cost vaccines that are recommended by ACIP. On top of that, recommendations that apply to children require the government to pay for the vaccine under the Vaccine for Children program, or VFC, for anyone who meets financial requirements, basically children living in poverty. And we have yet to see what implications the changes at ACIP are going to have on these, but this is something that I caution people to stay tuned.
We've already seen, just last month, federal health officials announced that COVID vaccines no longer on the list of recommended vaccines for healthy, pregnant women and children. What do you think about the decision-making that went into that announcement?
Well, a couple thoughts here. First, with the pregnant women, we know that COVID disease during pregnancy has very high risk. Also, we know that one of the higher groups that are hospitalized are newborn infants through the first 6 months of life. And those are individuals that cannot be vaccinated. But if the mother receives vaccine during pregnancy, the baby is born with maternal antibody and protection for the first 6 months of life. So I would argue that almost all the professional societies out there, American Academy of Pediatrics, American College of Obstetrics and Gynecology, and American Academy of Family Physicians, are all strongly opposed to the decision making that was not done transparently, it was not evidence-based, and it caught our COVID-19 vaccine work group entirely by surprise. I will say that here in Wisconsin, our Department of Health Services has come out strongly in terms of maintaining vaccination for both pregnant women and children.
I want to turn from COVID to measles. We've seen measles outbreaks around the country. The state's Department of Health Services says, hey, Wisconsin kids, pretty low vaccination rates compared to the nation as a whole. What are you watching for now from this partially reconstituted committee when it comes to measles and the worries about low vaccination rates?
Well, first and foremost, for what I would call a public health emergency across the country, with the highest level of measles cases we've had since 2019, and we're likely to surpass even that on the ACIP agenda for June 25th and 26th, there is no mention of measles whatsoever, except for a session on the measles, mumps, rubella, and varicella vaccine, which is aimed at safety as opposed to confronting this public health emergency. So this is very atypical from my experience with ASIP, that will respond to emerging threats with public discussion of where we are, where we should be going.
Dr. Temte, we'll leave it there. Thanks again for joining us today.
And thank you for having me. Have a wonderful day.
That's Dr. Jonathan Temte, professor of family medicine and community health and associate dean for public health and community engagement at the UW School of Medicine and Public Health. He chaired the Federal Advisory Committee on Immunization Practices from 2012 to 2015. But talking about that committee and the removal of all 17 sitting members of it by U.S. Health and Human Services Secretary Robert F. Kennedy Jr., and what that in turn means for vaccine access here in Wisconsin.
Coming up on Wisconsin Today, as a tribe in Fond du Lac tries to restore its full federal recognition status, a researcher explains this history in her own tribe.
In order to continue being a settler colonial nation, the United States needs to take native land. That affects how tribes have a relationship with the federal government or not.
That's ahead on WPR News. It's Wisconsin Today. I'm Kate Archer-Kent.
And I'm Rob Farrett. There are nearly 1,000 Native American tribes in the U.S., but about 400 are not recognized by the federal government.
For decades, Native American tribes have petitioned for recognition, which is a lengthy administrative process through the Interior Department.
Currently, it's unclear how federal recognition cases will be handled by the Trump administration and whether tribes will have a pathway.
Here in Wisconsin, one tribe that lacks federal recognition is the Brothertown Indian Nation. Producer Colleen Leahy wanted to see how this issue affects tribal members and brings us this story.
There are 11 federally recognized Native American tribes in Wisconsin, but one tribe, the Brothertown Indian Nation, is not federally recognized.
Iyamputuwakanak. That's really an Algonquin word that's 22 letters long, essentially meaning brother town or band of brothers. My name is Phyllis Olivia Tausey, and I am the chairman of the Brothertown Indian Nation, and I have been for the past 3 years. And before that, I was working as chair of the Restoration Committee. The Brothertown Indians have moved 6, or depending on how you count it, 7 times until we got to Wisconsin.
But even as groups of Brotherton were starting to make a home in what's now Wisconsin, the Indian Removal Act was passed in 1830, which forced all tribes to move west of the Mississippi.
There were pressure on us, once again, this time to move to Kansas. No one wished to move to Kansas. for any number of reasons. And our ancestors decided to take another strategy. Our leadership looked around and realized, of course, that no one was asking the non-Indians to move so their land could go to someone else. Nobody was doing that. So there was a belief that owning our land individually, which tribal people were not used to, our people were not used to that. Owning the land and being citizens would protect us and would prevent us from being removed to Kansas.
That strategy worked. The Brotherton stayed in Wisconsin. But the decision they made in an 1839 treaty to become citizens and own their land had serious unintended consequences. The Brotherton didn't know this, but when they signed that treaty, the government terminated its trust relationship with the tribe. That means the government no longer had an obligation to protect the tribe's land and resources, and it no longer had to treat the Brotherton as a sovereign nation. That's still the case now, nearly 2 centuries later.
And, just looking at the historical record, we, as a tribal entity, do not believe that at any point, there's just nothing that points to the fact that we intended to give up our tribal identity.
The Brotherton aren't alone in this. About 400 tribes across the U.S. don't have federal recognition. Non-federally recognized tribes lack a lot of the rights that recognized tribes have. For example, they don't have the right to enforce their own laws or run their own court systems. During the pandemic, non-recognized tribes missed out on COVID relief funds. I decided to go to the Brotherton's 8th annual spring powwow in Fond du Lac to get a sense of how tribal members feel lack of federal recognition has affected them.
And that's the idea behind community. We're not talking about a certain mailing address or you got to be here, you got to be there. We're talking about we're all related, we're all relatives. And this celebration is especially poignant with the condition that has been pushed upon the Brotherton people over the years in the form of a theft of identity, a theft of heritage. And this is a step in conquering all of that.
We don't have the same rights as other tribes that are federally recognized. I'm Hector Marroquin, and I am one of the council members here at the Brothertown Indian Tribe. I'm actually the youngest council member, and I was appointed about 3 months ago. The Oneida, the Menominee, the Stockbridge, those tribes have more rights because they have that federal recognition. They have a relationship with the government, and so they have resources available that the government allows. So with us not having that, it creates a definite disadvantage for us to be able to work on projects that we want to be able to acquire land more easily, to be able to be more focused on our community. And so with that, we just are wanting to get back to being a sovereign nation that can govern ourselves.
We have a true identity that's been around since the 1700s with very well documented history and lineage. My name is Faith Ottery, MD, PhD. I actually am a council member for the tribe. It's my second time on council. Our identity isn't dependent on a piece of paper from the U.S. government, but there are a number of benefits. For example, protection of our tribal cemeteries that are not covered if we're not federally recognized. So it's not just education and health services and other things that people tend to think of, but it's other things like protecting our lands and our cemeteries and our people who passed before us.
My name is Shelley Decker. I am a Brotherton Indian member. And my father, Dick Welch, used to be the Native American storyteller and elder for the tribe. Unfortunately, he passed away in 2019, and then they no longer had a storyteller. So I'm trying very, very hard to fill in his humongous moccasins. Some people think that because we're Native American, we're trying to build a casino and we just want a lot of money and all of that kind of stuff. That's not what this tribe is about. We are just trying to gain our heritage back. We just want to be able to share our tribe and our customs and everything with people.
My name is Michelle Miller, and tomorrow is my granddaughter's 11th birthday. And we're not usually able to come because we live on the other side of the state. But for her birthday, she wanted to come and show a couple of her friends our heritage. I was about 15 years old when I remember us trying to go towards recognition again. And I'm 60 now. So it's like we've done so much work and so much effort, and then to get disappointed time and time again.
My name is April Mohawk, and I am a Brothertown citizen. I'm here as a vendor today, and I love coming in and gathering with the people who come out. A lot of them are Brotherton. Some are from our other local tribes like Oneida Nation and the Stockbridge Munsee. So without federal recognition, it's really difficult to advance, like educationally. You don't get those benefits. We can't protect our cemeteries. We have cemeteries over here not too far away, 5 miles away, in the middle of hay fields, and there's nothing protecting them. They're just stones out in the middle of nothing, and we just pray that the farmers, don't plow over them. We don't get funding or support to work on language restoration. Like everything that we do it with our own time and own money, and we have to work real jobs too. So our members don't get paid to keep these things in place. It's all, we do it because this is who we are.
For Wisconsin Today, I'm Colleen Leahy.
And special thanks to Sarah Hopeful for sound design.
Now, our next guest traced the history of her tribal community's ongoing struggle to receive formal federal recognition, and her book that came out last year serves as an essential resource for her tribe.
Olivia Chilcote is an associate professor of American Indian Studies at San Diego State University and the author of Unrecognized in California, Federal Acknowledgement and the San Luis Rey Band of Mission Indians. Olivia, welcome to Wisconsin Today.
Thank you for having me. I'm really excited to be here.
California, where you're from, has the largest indigenous population of any state, more unrecognized tribes than any state. And your own tribe is in this situation, lacking federal acknowledgement. Can you talk about how that's affected you personally?
Sure. So I grew up just always knowing that my tribe was different than other tribes in our local area, and especially in the fact that we don't have a reservation like many of our sister tribes do in the county. And so that was just something that I was curious about and wondered, what made my community different than others in our same area. And part of that as well is my mom was on our tribal council. So those tribal council meetings would often happen in my own dining room. So I grew up hearing about the various issues that my tribe was confronting. And one of the main issues was our lack of federal recognition and the work that people in my tribe were putting into pursuing that status. And so it really shaped my understanding of my own Native identity and my own personal experience.
So many tribes lost recognition in the 1950s and 60s because of this federal policy called termination. What was the federal termination policy and how did it affect tribes?
So termination policy was all about severing the relationship between tribes and the federal government. So it was a time period in which this concept of recognition was being actively worked against on the part of the federal government. So the tribes that were subject to termination, in many cases illegally so, their government-to-government relationship with the federal government was severed and came to an end, and that had a lot of repercussions for tribes at the time, and then those that are still terminated to this day continue to contend with that status, and I think most actively are pursuing to have their federal recognition restored because of the rights and resources that are attached to having a federally recognized tribal status.
Some tribes also lost recognition in the 19th century, like the Brothertown tribe here in Wisconsin. Some tribes never gained recognition in the first place, as you've pointed out. How do you make sense of this type of history?
I make sense of it in understanding that in a lot of ways it's by design because of the fact that the United States is a settler colonial nation, then that affects how tribes have a relationship with the federal government or not. So to me, I kind of see these various ways that tribes either had their recognition taken away or never had that official relationship with the federal government as part of colonization and the kind of colonization that continues to this very day.
And you've written about how in California, 81 tribes have sought federal acknowledgement, but only one has succeeded. The Brothertown here in Wisconsin fought for 30 years for federal recognition, only to be told that they were in the wrong process and should have been petitioning for restoration. What can you tell us about the federal acknowledgement process? Is it confusing? Is it adequate? What is it like?
So the federal acknowledgement process is a very controversial process. It has come under a lot of scrutiny. It has been highly criticized by academics, by attorneys, by tribal peoples. The process tries to have a cookie cutter model fit all kinds of tribes that have their own unique histories and their own circumstances that have developed over time. So it's really difficult to be able to, fit into this model that may not be compatible with the historical realities of all different tribal experiences across the country. So one of the aspects of that process is that the tribe pursuing it cannot have been a terminated tribe. And in the past, it's only been since 2015 when the regulations were changed that the burden was put on the federal government to determine if the tribe had been terminated or not. Whereas prior to 2015, tribes were making the case that they were or were not terminated, so having to make that argument, which it seems like for the case of the Brothertown Indian Nation, that burden was being put on them to prove that to the detriment of their pursuit of recognition through the process.
Circling back to your tribe now, and what it's gone through for generations, as you look at the history of the San Luis Rey Band of Mission Indians, what does the tribal community feel today for, working toward federal acknowledgement and what the situation is like, especially now under a Trump administration?
Yes, that's a great question. So our community is really dedicated to pursuing federal acknowledgement, and it's an initiative that people in our tribe have been working on for decades, even prior to what we think of contemporarily as the federal acknowledgement process. And it's something that we have been in pursuit of, because we did have a treaty with the United States that we were signatory on. So when that treaty was not ratified in 1852, it sort of set the stage for this ongoing pursuit of having that government-to-government relationship that was denied to us when that treaty was never approved, when it wasn't ratified. So it's something that has been a very inherited struggle, and I think that that's a similar case in a lot of unrecognized tribal communities, that this is something that's been going on for a very, very long time, and it's an inherited injustice, as some have put it, that has been passed down. And so now our contemporary community is put in the position to once again try to pursue this government-to-government relationship, and it is something that we are actively working towards.
As we end here, what happens next for your tribe, and what are you working on in your scholarship?
Yeah, so for my tribe, I think we are really recommitting towards our pursuit of recognition. The publication of my book just about almost a year ago now has really reinvigorated our community towards that goal. So we are working together to pursue recognition through the federal acknowledgement process and just kind of coming together around that goal.
Olivia, thank you so much for sharing your research. Thanks for joining us.
Thank you so much again for having me.
That is Olivia Chilcote, an associate professor of American Indian Studies at San Diego State University and a member of the San Luis Rey Band of Mission Indians. Her book documents her tribe's struggle to become a recognized federal tribe.
Coming up, a community in southwestern Wisconsin lost their public pool a few years back. Now a new swimming pond is getting ready to open this summer. Find out what it took to make it happen.
We're just so excited about the potential and the possibilities that this is going to bring for our community.
A successful community effort in Blanchardville, next on Wisconsin Today.
You're listening to Wisconsin Today. I'm Kate Archer-Kent.
And I'm Rob Farrett. A group of doctors and nurses at Group Health Cooperative's primary care center in Madison is fighting to form a union. The conflict shines a light on the state of primary care medicine today. Nick Rommel spoke with members during a recent strike at Meritor Hospital in Madison.
We are the union! We are the union!
In late May, nurses at Meritor marched outside their hospital, carrying signs that called for higher staffing levels. They argued that better staffing would help healthcare workers and their patients, and they were joined on the picket line by doctors and nurses from the primary care provider Group Health Cooperative, or GHC. In December, a group of GHC employees filed a petition to unionize with the Service Employees International Union. They feel that management has eroded the unique community and preventive approach they value at GHC. And they also feel that having a say in those decisions would improve GHC for everyone.
We want to have more say in the management of our organization and move away from just thinking about profit and corporate, needs and desires to be thinking about, really truly patient-centered, focused care.
That's Kyoko Felland, a physician assistant at GHC. To her, one example of that was her company phasing out its in-house psychiatry service for patients who were acutely depressed or suicidal. All that did, she said, was make primary care doctors have to do more with less.
When there's not a mental health provider in the clinic, it goes to us. There's nowhere else for that to go.
On the nursing side, certified medical assistant Katie Cloud says the staffing issues affecting nurses in hospitals are present at GHC too.
There's too much work and not enough people to do the work, not enough people to make the phone calls.
Within days of the picket, the nurses union at Meritor had reached an agreement with management, but GHC providers are still fighting. The issues that doctors and nurses are seeing at GHC fit into a larger pattern. The fact that primary care across the country doesn't make enough money. That's according to Hayden Rookley, fellow at the American Economic Liberties Project and Brown University. He researches corporate consolidation and labor organizing in healthcare. He says primary care is increasingly used by big healthcare corporations as a way to funnel patients into more lucrative hospital procedures. That puts independent primary care providers like GHC in a tough spot.
An overall competitive landscape where primary care sort of as a standalone feature is really unprofitable.
He says more and more doctors, including those in primary care, are turning to unions to have a say over how to do their job. In fact, he found that in 2023 and 2024, the same number of physicians joined a union as in the 22 years before that combined.
There is a real sense among this workforce that they're simply not able to carry out their calling of their profession.
GHC management says it supports its employees' right to unionize, but the process has been rocky. The union's original goal was to represent staff at just one clinic. Management argued that an election had to take place at all clinics, so the decision was thrown to the National Labor Relations Board. 2 months later, in March, the board decided in management's favor. The union claims management used that time for a union-busting campaign. It's charged the company with dozens of labor law violations. These include firing a worker for union activity, soliciting screenshots of a pro-union group chat, and banning employees from discussing the union at work. At the Meritor picket, Dr. Nisha Rajagopalan said there have also been more managers in the hallways and in the break rooms. It's being presented as management being more available, she said.
But it feels very different in this particular situation when all of a sudden somebody who's never been there before is now there.
GHC management declined an interview request, but in a statement, an executive called the charges unfounded and said they were aimed at avoiding an election. Meanwhile, the union has claimed management's actions make a fair election impossible. Organizers are calling on the company to recognize its original proposed union. A potential election date is still up in the air as the Labor Relations Board resolves the union's charges, as well as coercion charges made by GHC management against the union. Nick Rommel, Wisconsin Public Radio.
This is Wisconsin Today. Now, visiting the local pool is a great way to cool off this summer and gather with friends.
But a community in Lafayette County in southwestern Wisconsin lost their local pool.
Back in 2019, the village of Blanchardville closed their public pool after it was deemed unsafe and unfixable by Wisconsin's Department of Safety and Professional Services.
Neighborhood volunteers then took it upon themselves to replace it. After years and countless hours of development, they're opening a new swim pond this summer.
Today, we're learning more about the community project and what it took to make it happen with two members of the Friends of McKellar Park, Inc. in Blanchardville. Judy Moen is president of the group. Marcia Crooks is the project manager. Marcia, welcome to the show.
Thanks for having us.
And Jody, thanks for being with us.
Yeah, I'm glad to be here. Thank you.
Let's start with the end of the old pool. Jody, what led the community pool in Blanchardville to close back in 2019?
The pool has always been a big part of the community. It's been over 60 years that the pool has existed, but before that it was a pond. Probably for the last decade or more, the pool had been facing a lot of major issues. There were leaks, water had to be replaced every few days, the structure was crumbling. It was a major hub for recreation, but it just wasn't safe anymore. And then DNR ended up determining that it just wasn't safe to keep it open. The village had to make the tough decision to close it down.
And Marcia, it sounds like this was a long tradition in the community, and people noticed the absence of this swimming place. How did this affect the community?
Yeah, I would say summertime in Blanchardville, the McKellar Park pool was kind of the heart of the community. Many of us learned how to swim in that pond, myself included. And it was a place to see your friends in the summer, for high school kids to have jobs, for our fire and EMS to have dive training. So the community definitely sensed the loss of the pool immediately upon its closure.
And Marcia, you're the project manager for the new swim pond. Now, the repair of the old pool, that was out. Looking at a new pool, people may not think of it. They can be expensive for a community. What ended up making the idea of, hey, let's just have a new pool ultimately not the path to pursue?
Yeah, our committee, we've been at this for 5 years. We started our first big fundraising event right before COVID shut the world down, right? And so it kind of put a hold on things. And when we sort of resurfaced after COVID, the cost of this pool that we were going to build just kept climbing and climbing. And the pool wasn't truly what we desired for our community as far as the design in regards to what we could afford. And it was just starting to feel like that number was unattainable for us. We were writing for lots of grants, but nobody wants to really fund an outdoor pool in these communities anymore, is what we discovered. So we put our heads together to just try to figure out what alternative solution could we have. And we started talking about a swim pond and looking at photos. And we all just really love that we're going back to the roots of where this all started. There was a pond there a very long time ago, switched to a pool, and now we're going right back to a pond again.
Jody, we'll get into the swim pond in a little bit, but as you were going to the community and saying, okay, the pool doesn't look like it's going to happen, a pond, a swimming pond, how did people respond to that idea?
Honestly, it was overwhelmingly positive. When Marsha first proposed this to our group and we saw the possibilities of it, we were very excited. And it was presented to the village board and they took it with great enthusiasm, and we shared it on our Facebook page. And just the amount of outpouring of support with it was tremendous. And ever since then, we've had a couple of events to fundraise and things that we always do a couple of annual events anyway, but just having the number of people that have sent checks or have posted things on our Facebook page or just sent notes or see us in public, the support is quite amazing.
We're talking about a new swim pond opening this summer in Lafayette County. We've got Jody Moen and Marsha Crooks of the Friends of McKellar Park, Inc. That's in Blanchardville. We're finding out what it takes to make a local community project like this a reality. Marsha, talk us through the swim pond. Now, this is an artificial pond, if I'm looking at things right?
Yeah, so we're working with several different people to make this happen. So we've been working very closely with Wisconsin Lake and Pond. Our swim pond will have a synthetic liner, so it's not going to be a mud bottom, dirty, mucky pond. It'll be very clean. There will be 6 to 8 feet of water clarity. So once that synthetic liner's in, we can start filling. Our group will continue to fundraise to pay Wisconsin Lake and Pond to come in and treat the water. So we make sure it's great quality for all of our people who want to use it. We're working with Wisconsin recreation specialists to get some nice big inflatables in there. We'll have a big one in the deep end and a smaller one in the shallow end. And we're just so excited about the potential and the possibilities that this is going to bring for our community.
Jody, you mentioned the fundraisers. What goes into planning this out so it's not just, hey, we have enough money to build this pond, but we have a sustainable plan to maintain this swimming pond on into the future?
Yeah, we actually, with the money that we've raised so far, we've been investing in CDs and different things so that we can keep that going. And we'll continue the events that we do. We have a golf outing that will be coming up in October. And then we have what we call the Blue Jean Ball, which is always in April, and it's located in Blanchardville. And we've had great support for that event. We've gotten a really good following of people and a lot of loyal people that just consistently send money or support us in some way or another or help us promote all of this. So I think now that people are seeing the construction happening right now, that is even making it more real. And we'll be looking to build a shelter eventually, which actually we hope sooner than later.
Marsha, I used to work at my uncle's swimming pool store. I know what goes into a pool to keep it clean, the chlorine, the filters, and so on. A swimming pond, what kind of maintenance, what kind of things do we have to do to maintain that and keep it clean?
Yeah, so we're really relying on Wisconsin Lake and Pond for that piece. They are the experts. So our organization, as Jody said, will continue to fundraise so that we can pay them to come in monthly or more frequently if needed to treat the water. Of course, a pond is going to be more natural than a pool where there won't be the harsh chemicals in there.
Marsha, did I see something about a largemouth bass being part of the picture here?
Yes, there's been a lot of talk about fish in the pond. So we will not have a lot of fish in the pond. It will not be a fishing pond. It's a swimming pond. However, if we have any issues in the pond with any kind of things we don't want in there. Leeches maybe would be an example of that. We're told by Wisconsin Lake and Pond, if you release a bass or two into the pond, they'll take care of all of those things we don't want in there, and they control their own population. So we won't have to worry about having an overabundance of those in there.
Jody, I understand this isn't just, hey, we're going to have a place to swim and get out of the heat. There's going to be things like CPR or swimming training, Red Cross swimming training, other community educational opportunities. What all will happen in this pond when it's open?
Yeah, there's lots of big goals here. The pool used to have CPR training and things like that, and what we've learned from this pond exploration is that we can have all the same benefits that we had with the pool. As Marcia mentioned too, with the largemouth bats, I just wanted to say that those fish like to hide, so they're not going to be a big problem for people as well.
Marcia, this has been going for a while. You're the project manager. What does it feel like now that you're knocking on the door of a grand opening?
Oh my gosh, I can't even explain how good this feels for everyone on our team. I think excitement, happy tears. We've been working on this for so long, and I think it's really sinking in just the long-lasting impact that this is going to have for our community. And it's going to provide recreation for all ages. And that's why we continue to persevere and persist through all of these challenges with our fundraising and everything, because we want something that's going to serve the entire community, and not just the kids, because it's about everybody. It's about the children, but it's about the whole community too.
Jody, I want you to talk to people around the state who might have that need in their community, replacing something, repairing it, or something new. Might be a swimming pond or pool, might be a museum or baseball field, whatever it might be. What do you recommend to them to get the ball rolling?
Oh, that's a tough one. Persistence. We have a group of women in our committee, 7 very strong women that are very smart and very determined, and a lot of networking. I think we all have a special area. I feel like we've learned a lot about each other in the last 6 years. So I think just building on the skills that everyone has. One of us, does a lot of in-person, face-to-face, reaching out to people. I do a lot of computer work. Marcia just has the social skills, and she had a lot of connections with the village board. We had, all of the ladies in our group have just done tremendous contributions to things, and persistence is the word, I would say.
And we'll leave it there. Jody, thanks for joining us today.
Yes, thank you.
And Marcia, thanks for being with us.
Thanks for having us.
That was Jody Moen and Marcia Crooks of the Friends of McKellar Park, Inc., talking about the new swim pond in Blanchardville and what it took to make that community project a reality. They tell us the pond is on track to open in early August. Here in Wisconsin, temperatures above 90 degrees for 2 or more days in a row are considered extreme heat, and parts of the state could see some of those days pretty soon.
And we want to know, how do you prepare yourself for heat waves? Do you work outside? What do you do differently to stay cool? Do you live without air conditioning? How do you keep your home cool and tolerable?
Maybe you've gone to a mall, library, used an official cooling center to get a break from the heat. Email us with your tips, your stories about managing the summer heat. Send an email to wisconsintoday@wpr.org or call or text to get in touch. You can do that at 888-642-0232. That's 888-642-0232.
Wisconsin Today producers include Beatrice Lawrence, Colleen Leahy, and Courtney Everett. Our technical directors are Jeff Robbins and Tyler Ditter. Learn more about us at wpr.org/Wisconsin Today. I'm Kate Archer-Kent.
And I'm Rob Farrett. You're listening to WPR News.